Voices against corruption. Let the people speak.
Hello and welcome to Primorg's public feedback series on corruption, called Voices Against Corruption. And we ask, do you think our healthcare delivery system will improve if public officials are prevented from seeking medical care abroad?
How can you improve? Is it possible that it will improve if they are prevented from taking medical care abroad? If you don't see a problem as a problem, do you think that you can ever look for the solution to that problem? It's not possible. So the system, we need to create a system whereby we will prevent these people from seeking medical help abroad. If we do, then all of us, we can now sit around the table and now discuss how to put in place a very good medical architecture in Nigeria that will serve everybody.
I believe it will go a long way because they are the ones that pilot the affair of this country. Like when COVID-19 was on a high alert, everybody was within, we all live in Nigeria. If all of us should come together, try to see within and develop our health system, like creating more base to train the doctor and other medical staffs, it will go a long way. Then we'll see how we can develop our hospitals by bringing equipment, go a long way in train the trainers. It will go a long way, but the way they are flying out, nobody care to say, okay, let us do something concerning our healthcare. So it's down on the poor. The poor is always on the receiving side.
The ways most of our public officials are traveling outside the country is for medical health is very bad. Economically, it will affect us. Why can't we improve our own health care in Nigeria? Because if you look at it, most of the hospitals lack many health facilities. Some patients are dying because of the way our hospitals are poor in terms of equipment.
I think it will, to an extent, help the situation in order for the leaders to feel what the people are really going through. So, because there's a popular saying that says charity begins from home. So if our leaders are not allowed to go outside to have their medical attention, having it home here would mean that they will need to look inward to see where we've gone wrong, gotten things wrong, and begin to make things right.
It is always said that charity begins at home, and a man's resolution to succeed is more important than any other. So you cannot jettison building your own locality where you are emanated from. So it is not a doubt that when these people build their own home, it will serve them better than going outside to seek for what they can get in their own home. It's a matter of sense of belonging and sense of responsibility. So if they take the responsibility to import whatever machinery, they are going for over there, using it, importing it to their own locality and building their own home, I'm sure that they will get same quality service here compared to where they are going. So it's important.
The way we see our system here in Nigeria, most of our public service officials, they like traveling out to take care of themselves or if they have medical issues. And this has rendered a situation whereby they don't know what is happening in our own health sector. So in a place whereby they are stopped or there's an embargo from them traveling outside, they'll be treated here. And when they get to the hospital, they see that the infrastructures, the way they treat people and all that is not, well done. They themselves will try to improve because they also will want a better health care.
Those in the public position, in a higher position that has the economic power, financial power to travel out, render the improvement of the health sector in Nigeria fruitless. In the sense that you realize that any small thing, they are out of country, while many are suffering. The masses are not getting the best medical service as required. If you can move inward and rebuild all our health sector, I believe that no one would want to travel outside Nigeria for any other thing. There should be a good example. Those people in the power, in the position.
If our elites or government officials are stopped, because at the end of the day, when you don't experience what others are experiencing, you find it difficult to know the challenges and how to come in to help them remedy the situation. Like I earlier asked, when will other leaders from other countries come to Nigeria on health grounds actually to get treatment and actually see how we operate here?
If you ban all our leaders, not only the president, not only the vice president, of course all our leaders, governors, senators, House of Rep members, and everyone who are in authority, ban them from traveling abroad to take treatment. Definitely, because they will invest that money they are using outside, they will invest in this country. It will provide even job opportunity for the hospitals and every other institutions that have to take care of the needs of our people.
To be a right step in the right direction, that public officials should stop using taxpayers' money to fund medical tourism, to go a long way in improving our medical system.
Who is going to prevent them? I don't think they're the one in charge. So it will improve if things are fixed in order, things are well organized. But I so much believe that this has been a policy on ground, that the bourgeoisies, they are the ones controlling the affairs of this country. So they have everything to go outside country and treat themselves.
In the first place, we don't have policy formulations. If we have policy formulations, is the first thing we should do. If everybody is being treated in Nigeria, both the high and the low, then it will behove on us to be able to implement policies that will be able to put in place a proper structure for our hospitals. They leave our dilapidated medical facilities here and go to treat themselves abroad. I think that's the first thing the policy formulation should stop.
Primark's public feedback on corruption in Nigeria is produced with support from MacArthur Foundation.